Hello, welcome back BTS Pharma Research Institute. Today we will discuss pharmacology topic that is opioid analgesics and antagonists. In this topic, mainly discuss about four subclasses are there. First one, history of opioids. Second, opioid pharmacology. Third, opioid chemical classification. Fourth one, drugs classification based on their mechanism of actions. So first one, history of opioids. The opium poppy was cultivated as early as 3400 BC in Mesopotamia. The term opium refers to a mixture of alkaloids from the poppy seeds. Opiates are naturally occurring alkaloids. So these all opiates are naturally occurring alkaloids such as for example morphine and codeine. So opium poppy, which is botanically known as Papaver somniferum, belongs to the family Papaveraceae. And opioid chemical classification, opioids are classified into four chemical groups based on their structure. So based on the basic nucleus of the compounds, chemical classification will be divided. So here all opioids divided into four classes based on their basic nucleus. First one, phenanthrene derivatives and benzomorphines. Third one, phenyl piperidines, diphenyl heptanes. In the first one, phenanthrenes, these opioids contains a 6-hydroxyl group. Here examples of phenanthrene derivatives: morphine, codeine, hydrocodone and oxycodone. Second class, benzomorphines. These opioids includes pentazocine. Third class, phenyl piperidines. These opioids include fentanyl and alfentanyl and meperidine. Fourth class of opioids, diphenyl heptanes. These opioids include methadone and propoxyphene. Next class, opioid drugs are classified as agonists of the receptors and mixed agonist and antagonist activity and antagonist based on how they interact with, how those opioid drugs will interact with the opioid receptors. Analgesic effects at opioid receptors, already we'll discuss mu receptors, delta receptors and kappa receptors are there. So mu receptors divided into again two classes, mu1 and mu2. mu1 is analgesia, mu2 receptors acts as sedation, vomiting, respiratory depression, like that. Delta receptors mainly analgesia and spinal analgesia. Kappa receptors analgesia, sedation, psychomimetic effects, meiosis, respiratory depression, euphoria, like that. So mainly here again three classes are there: endogenous peptides, agonists and antagonists. Endogenous peptides mainly enkephalin, beta endorphins, dynorphin A. So first one, enkephalins acts as a agonist at mu receptors and delta receptors. Beta endorphins acts as agonist activity at mu receptors and delta receptors. Dynorphin A peptide is agonist activity on mu receptor only and kappa receptors. So next one, agonists. Morphine, codeine, fentanyl, meperidine, methadone. These all are opioid agonist drugs. So morphine acts at agonist activity at mu receptors and weak agonist activity at kappa receptor. Codeine, weak agonist activity at mu receptors and delta receptors. Fentanyl acts at mu receptors and meperidine agonist activity at mu receptors and delta receptors. Methadone also acts only at mu receptors. Opioid antagonists, naloxone and naltrexone. These two drugs are strong antagonist activity at mu receptors and kappa receptors, weak antagonist activity at delta receptors. So naloxone and naltrexone acts all three receptors, mu, kappa and delta. Now we will discuss about examples of the opioid agonists and opioid antagonists and opioid agonist and antagonist drugs. First one, opioid agonist drugs. These drugs bind to and activate opioid receptors in the body, both central nervous system as well as peripheral nervous systems. Example, morphine, codeine, oxycodone, one ketone group here. Second one, opioid partial agonists. This buprenorphine is classified as a partial agonist of opioid receptors. It has a high affinity but low efficacy at the mu receptors, where it yields a partial effect upon binding. So low efficacy. So therapeutic activity was very low. So it will considered as a opioid receptors partial agonist, buprenorphine. In this section, next class, opioid antagonists. These drugs bind to opioid receptors and prevents from the being activated. So completely opposite action of the opioid agonists. So examples of opioid antagonists, mainly naloxone, naltrexone, methyl naltrexone and elvimepan. Naloxone and naltrexone drugs were main opioid antagonists activity. So naloxone is used to treat opioid overdose and respiratory depression, reverse respiratory depression. Next one, opioid agonist antagonist, mixed activity. These drugs consist the mixed activity. These drugs can treat moderate to severe acute pain. Examples include pentazocine, butorphanol and nalbuphine. They can bind to and activate opioid receptors to some extent, but can also block the effects of other opioids. Mixed activities there. These three drugs acts as a agonist and antagonist activity. Main drug in this class is the pentazocine. So in this topic, main drug was morphine. Morphine consists of a benzene ring with a phenolic hydroxyl group at position 3 and an alcohol hydroxyl group at position 6 and at the nitrogen atom. So mainly in the morphine structure, third position and sixth position hydroxyl group was there. Both hydroxyl groups can be converted to ethers or esters. For example, codeine is morphine, that is O-methylated at position 3, while heroin is morphine O-acetylated at position 3 and 6, diacetyl morphine. Heroin, other name was diacetyl morphine. At third position, will methyl group added, then it will called as a codeine, and third position and sixth position with diacetylation, it is called as heroin. Heroin is another name was diacetyl morphine. Finally, conclusion of this topic, mu receptor agonists and agonist antagonists have been used throughout recent medical history for the control of pain and for the treatment of opiate induced side effects and even opiate withdrawal syndromes. So thank you all.